Hi, it's Nicole Reina, and I am going to present a case of a 68-year-old female with a headache, cough, and diarrhea. So we saw this patient via telehealth because of the type of symptoms that she presented with. She was complaining of a headache and a cough times 4 days and diarrhea times 2 days with no fever. The headache, she said, kind of felt like sinus pressure and was not fully relieved by Tylenol or Motrin. She was complaining of general body aches, exhaustion, a dry cough, bilateral nasal and ear congestion, and a 1 day history of a sore throat. Her diarrhea was happening about 1 to 2 times per day, and she only had that for the last 2 days. But she said she was not sure if this diarrhea was related to this present illness or if related to a history of a GI ulcer, which she is seeing GI for. She was on triple antibiotic therapy and completed the course of treatment for an ulcer and H. pylori, and then she continues on Prilosec. She lives at home with her husband, and he has the same dry cough and headache times 1 week. Past medical history, menopause, peptic ulcer, H. pylori, a history of exercise-induced asthma, and seasonal allergies. Past medical procedures, the only thing that she has is in September she had an endoscopy and a colonoscopy and was diagnosed with peptic ulcer disease, H. pylori, and one polyp was removed through the colonoscopy. Patient is medication-wise on a multivitamin daily. She's on Prilosec 20 milligrams at bedtime. She is on vitamin C 500 milligrams daily, calcium citrate with vitamin D 600 milligrams, and 400 IU BID, and albuterol for her history of asthma, 1 to 2 puffs, and she has it written for Q 4 to 6 hours as needed for asthma symptoms, which she says is controlled and she has not been using lately. Allergies, no known drug allergies, but seasonal allergies. She, of course, is menopause, denies a family history. Social history. So she lives with her husband. Reina, she denies recent or previous drug use. She denies what else? Alcohol use, except one or two on a holiday. She also reports no recent illnesses and no known recent exposures with anyone who has had COVID-19. She practices hand washing, social distancing with anyone outside her household, and wears a mask when she's in public. As far as immunizations, they're up to date. Her influenza, she got this month, 10-3. Her pneumococcal and shingles is also up to date, as well as her Tdap. So for review of symptoms, she did deny the fever, night sweats, chills. She did report fatigue and generalized body aches, though she does not have any recent illnesses that she's aware of. She denies palpitations, chest pain, edema, shortness of breath, apneic spells, or night sweats, but she did report a dry cough that is all day, and she thinks she has a wheeze. GI-wise, she denies any regurgitation symptoms, nausea, vomiting, anorexia, and she does report diarrhea 1 to 2 times per day, which is a loose, watery stool. Musculoskeletal, she does have a little bit of muscle aches, generalized, but denies any joint pain or swelling or anything like that. Neurologically, there's no changes, no history of head trauma or concussion. And as far as psych, no issues of depression, mood changes, or anything like that. And endocrine, she denies any heat or cold intolerances, any weight changes, polyuria, polydipsia, polyphagia, and hair changes or anything like that. Her vital signs were 118/78, pulse 68, temperature 98.8, and respiratory rate 21. Now, speaking with her on the phone, she does appear well. We spoke about how we can't assess her to the full potential since it's on a telehealth, but based on her symptoms, She looked good generally. Her pupils, of course, she were reactive. She had full range of motion. Her heart rate from her Apple Watch was 68, and we asked her to feel her pulse, and she said it did feel regular. She did not seem to be winded while speaking with us. She was able to converse. She said that she is not having any problems with activity or activity making her respiratory effort worse. No, GI wise, we asked her to palpate. She was soft, not distended as compared to her normal. Extremities she moved, skin looked good, not pale or anything. And then we did do a COVID symptom questionnaire that was from the CDC. And of course, she does meet some of the criteria for the current COVID-19. She has positive cough, positive fatigue, positive muscle and body aches, positive headache, sore throat, congestion, diarrhea. So those are some of those presenting symptoms. So I chose this case because we've seen an influx of COVID exposures or questions or possible exposures or people that have sinusitis or bronchitis that around this area that are now coming in. We're coming and taking care of them. So for differential diagnosis, I put COVID-19, influenza because it is flu season, and then community-acquired pneumonia, or another one could be bronchitis with the cough, or one other one could be asthma flare-up from her asthma. So as far as plan, we ordered a COVID-19 nasal swab send-out test and then a rapid influenza A and B. And what this practice is doing is we're having patients come at one time during the day, and we're able to do a test for them, the COVID test, out in the parking lot. So the patients aren't even getting out of their car. We walk up with a gown. I'm actually not doing them. My preceptor is, but we do the swab and then send it out to the lab. This way we're not bringing them into the office or exposing other people. So also regarding our treatment and therapeutic plan, quarantine is, we spoke about quarantine and starting 3 days ago when she first had symptoms, and she's to remain at home and for 14 days from the last exposure. Don't go out into public. Then we also discussed continuing present medications and her current vitamins. And then we told her to use her albuterol inhaler, 1 to 2 puffs every 4 to 6 hours for the next 2 days, just so that it opens up her lungs, especially with the history of asthma. And then Tylenol or Motrin per package instructions for the muscle aches and pains. Education-wise, we had discussed fluids to maintain hydration and to thin secretions. We had also talked about drinking water and Gatorade to replace the electrolytes due to the diarrhea. We discussed having to call the office if she had increased symptoms, increased fever, increased shorter breath, and of course, we always have someone on call at this office, or if it's urgent, we discussed how she needs to go to the ER. And then we also discussed wiping down all surfaces at the house, making sure that she is obviously wearing a mask, staying when she is out of quarantine, staying 6 feet apart, avoiding crowds, washing her hands, and then to make a follow-up appointment in 1 week to discuss with her. The other thing that we discussed is, since it is Thanksgiving, that she should be doing a no Thanksgiving with family or friends or anyone outside her household, and she verbalized understanding with that. So that is it for my case study, and thank you so much for watching. Have a great day.